In our next video in this series, we take a deep dive into 3 studies utilizing FMT in children with autism spectrum disorder, or ASD, and look at the improvements in gastrointestinal symptoms and autism-related behaviors. If you want to hear a review of this research, looking at FMT in children with ASD, check out our last video. In summary, fecal microbiota transplantation, or FMT, is the process of taking good bacteria from well-screened healthy donors and putting it into the intestinal tract of a recipient to restore gut health. In this video, we're going to highlight these 3 studies that I think really capture what we know right now in the research about fecal microbiota transplantation in children with ASD, and looking at improvements in gastrointestinal symptoms and autism-related behaviors. Our first 2 studies come from Dr. James Adams' group from Arizona State University, and these studies are considered the benchmark for the use of FMT in children with autism spectrum disorder. They've actually created a series of different clinical experiments looking at the long-term benefits of using FMT in children diagnosed with ASD. Here, we're going to highlight 2 of the studies from this that I think really highlight the importance of looking into fecal microbiota transplantation, specifically in children with ASD. Their initial 2017 study consisted of a modified FMT protocol called microbiota transfer therapy, or MTT, in children with ASD who experienced chronic GI issues. MTT first consisted of a pre-treatment, which was 2 weeks of vancomycin treatment, or antibiotic treatment, followed by a bowel cleanse before starting FMT. FMT consisted of 1 to 2 days of high-dose FMT, followed by 7 to 8 weeks of daily dosed FMT. This was then followed by an 8-week follow-up. So this is 18 weeks in total for this study. This 8-week follow-up was used to look at the long-term benefits of FMT in these children with ASD, focusing on GI symptom improvements as well as changes in autism-related behaviors. Their principal findings were, first, FMT improved gastrointestinal symptoms, with gastrointestinal symptom rating scale scores decreasing by 77%. In addition, they showed improvements in both stool type and frequency. Their second major finding were improvements in ASD-related symptoms, with a 23% decrease in childhood autism rating scale scores. Finally, FMT significantly increased the bacterial diversity in the gut, actually making it indistinguishable between children with ASD and their typically developing peers. At baseline, children with ASD were shown to have a decreased bacterial diversity, but this decrease actually improved and was non-existent after FMT treatment. In their next 2019 study, looking at the long-term benefits of FMT treatment in children with ASD, they performed a 2-year follow-up study using the same patients from their original 2017 study. Their major findings were, first, most patients reported that gastrointestinal symptoms continued to be improved from baseline or before they did FMT. They found that there was a 58% reduction in gastrointestinal symptom rating scale scores at 2 years after FMT. They also found that there was an improvement in the percentage of days where there was abnormal stool. Second, families reported that ASD-related symptoms slowly and steadily improved over the 2-year period. They actually found that ASD-related symptoms were more improved 2 years after treatment than when treatment initially stopped. Based on the childhood autism rating scale scores, these scores were 47% lower than baseline 2 years after treatment, than the 23% lower than baseline when the initial treatment stopped. Third, at the beginning of the 2017 study, 83% of participants were rated as severe on the Childhood Autism Rating Scale, or CARS assessment. 2 years after treatment, only 17% of participants were rated as severe on the CARS assessment. 39% were in the mild to moderate category, and 44% of participants fell below the diagnostic cutoff for ASD on the CARS assessment. Their fourth major finding was that improvements in gastrointestinal and autism-related symptoms were correlated, such that changes in the Childhood Autism Rating Scale scores were positively correlated with changes in the gastrointestinal symptom rating scale scores. This implies that the changes in gastrointestinal symptoms brought on by FMT may improve the severity of behavior in children with ASD. But again, this is correlative and not causative, and more research is needed. Another major finding is that the important changes in the gut microbiota at the end of FMT treatment remained at the 2-year follow-up, such that bacterial diversity was higher 2 years after FMT than at baseline. The third study I want to highlight is from Dr. Wei's group in 2021. This study consisted of a 12-week protocol, which had 4 weeks of FMT with an 8-week follow-up. This study stands out for 2 reasons. First, they utilized a short, only 4-week FMT protocol. As well, they used no pre-treatment before FMT, so no antibiotics or proton pump inhibitors. These changes may have impacted the magnitude and the durations of improvements seen in the children with ASD after FMT. They also highlight the importance of us better understanding what the length of FMT does, as well as the role pre-treatment before FMT can play. The major findings of this study are: 1. FMT improved gastrointestinal symptoms, with a 35% decrease in gastrointestinal symptom rating scale scores, as well as improvements in stool type, rated by the Bristol stool chart. 2nd, ASD-related symptoms improved, with a 6% decrease in childhood autism rating scale scores. 3rd, they found that FMT significantly changed the serum levels of different neurotransmitters, including GABA, dopamine, and serotonin. They also found that FMT promotes the colonization of donor microbes, such that they found a shift in the bacterial diversity of children with ASD towards that of their peers. At Novel Biome, we are dedicated to data collection throughout the FMT treatment process to help build support and an understanding of the use of FMT in children with ASD. Our treatment protocol is based off the groundbreaking work from Dr. James Adams, but utilizing an extended 16-week treatment protocol. To learn more about our dedication to data collection, our treatment process, or to book a call to talk with someone on our team, visit our website. The link is in the description. There's growing clinical interest in the benefits and treatment outcomes of FMT in children with ASD who are known to suffer from chronic gastrointestinal symptoms. Research to date has shown significant improvements in gastrointestinal and autism-related symptoms, and more studies are underway. While we know there is a need for more randomized clinical control trials, the research to date has shown a positive relationship in using FMT in children with ASD and modulating the gut microbiome to show improvements in both gastrointestinal and autism-related symptoms. If you liked this video, check out our next and last video in this series, looking to answer the question, can probiotics help with ASD? Research has suggested that one possible way to modulate the gut microbiome in children with ASD is through treatment utilizing probiotic, but to date, the research is inconclusive. If you want to read more about what I talked about in this video, or learn more about where it came from, check out our blog, the link is in the description.